Start the nerve style of the oral mucosa. Yesterday, आपने जो what is the oral mucosa, the types of oral mucosa, features of the oral mucosa, and the blood supply of oral mucosa. Now, today we discuss the nerve supply of the oral mucosa. Because mouth is a gateway to the respiratory and alimentary tracts, it is richly innovative. The supply is overwhelming century. Efferent supply is autonomic, supplies blood vessels and minor salivary glands and may modulate activity of sensory receptors. Second, third, visions of trigeminal nerve. Efferent supply is from facial, glossopharyngeal, and vagus nerves. The sensory nerves lose their myelin sheaths and form a network in reticular layer of lamina propria. Sensory nerves terminate in free and organized nerve endings. These specialized nerve endings have been grouped according to the morphology as mesons, referens, corpuscles, crescent bulbs, and mucocutaneous and organs. Sensory nerve networks more develops in oral mucosa lining interior than in posterior regions of mouth. That's more acute initiate reflexes like swallowing, gagging, and retching. Temperature receptions more acute in vermilion border, tip of tongue, and interior hard palate. Now we discuss the regional variations in structure of oral mucosa. Lip has a skin on outer surface and labial mucosa on inner surface. Between these tissues lie vermilion red transition to zone. Lips have striated muscles that are part of muscles of facial expression. Minor mucous lavary glands in some mucosa beneath oral mucosa. Skin on outer surface is similar to skin elsewhere with a keratinized layer of epithelium on a bed of connective tissue. Vermilion zone lacks appendages of skin, occasional sebaceous glands at corner of mouth, requires constant moistening to prevent drying, epithelium keratinized by thin and translucent, connective tissue papilla of lamina propria long, narrow, has capillary loops, hence the red color. Mucosa and cheeks, inner surface of lips, covered by the relative thick non-keratinized inner salivary glands. Dense connective tissue strands bind to underlying orbicularies. Sebaceous glands may be present in cheeks, adiposes, spots. Keratinized mucosa, masticating mucosa, during mastication, parts of oral mucosa are subjected to forces and pressures, gingiva and hard palate. Masticating mucosa covers areas like hard palate and gingiva, which are exposed to compressive and shear forces and to abrasion during mastication of food. Epithelium moderately thick, frequently orthokeratinized, though levels of parakeratinization may be seen. Junction between epithelium and lamina propria, convoluted papilla. Lamina propria thick contains dense network of collagen fibers as large closely packed bundles, enabling mucosa to resist heavy loading. Covers immobile structures like palate and alveolar process by direct film attachment to periosteum to form mucoperiosteum or indirectly by a fibrous mucosa. Lateral regions of palate shows fat and glandular tissues interspread with the fibrous mucosa to cushion mucosa and protect vessels and nerves. Gingiva is a masticating mucosa and covers the alveolar process of the jaw and surrounds the neck of the teeth. Gingiva. The gingival extends from the dentinogingival junction to the alveolar mucosa. The stratified squamous epithelium may be keratinized or non-keratinized, but most often it is parakeratinized. Types of gingiva. The gingiva is divided into three types. Number one is the free or unattached or marginal gingiva, attached gingiva, and interdental papilla. Free or unattached gingiva. This is the gingival sulcus. Free or marginal gingiva. This is the marginal gingiva. Uh, the attached gingiva and mucogingival junction. This is the alveolar mucosa. Free or unattached or marginal gingiva, it is that part of the oral mucosa that surrounds the necks of the teeth and forms the free margin of gingival tissue. It is differentiated apically from the attached gingival by a free gingival groove. The inner side of it forms the gingival sulcus. The free gingival mucosa is composed of stratified squamous epithelium that may be keratinized, parakeratinized, or sometimes non-keratinized. Second is the attached gingiva. The attached gingiva lies between the free gingival groove and the alveolar mucosa. The junction of the attached gingiva and the alveolar mucosa is called the mucogingival junction. In healthy mouth, attached gingiva shows stippling orange peel appearance, which is a characteristic of this type of mucosa. Interdental papilla, part which extends between interdental papilla. It has a facial side and a lingual side. Its margins are concave. Due to inflammation, interdental papilla lose its concavity. Width of a gingiva greatest in incisor region 3.4 to 4.5 millimeter in maxilla, 3.3 to 4.9 millimeter in mandible, least in premolar region 1.9 millimeter in maxilla and 1.8 millimeter in mandible. It is least in children and increases with age. Gingival sulcus show a V-shaped cervical arch space coronal to attachment of junctional epithelium. Normally 0.5 to 3 millimeter width, average of 1.8 millimeter. Depth greater than 5 millimeter is called the periodontal pocket. When the tooth first becomes functional, it lies at the cervical half of crown. It contains circular fluid, desquamated cells, neutrophils. Dental gingiva occupies gingival umbrature. It can be pyramidal, whole, whole, valley-like depression that connects facial and lingual papilla. Connecting facial and the lingual side of the interdental papilla. On the proximal side is an epithelial structure called hole. It is a concave shape, means gingiva is healthy. This is the connecting facial and lingual side of the interdental papilla. On proximal side is an epithelial structure is called the hole. Concave shape means gingival is healthy. It becomes dome shape in gingival recession and inflammation. It is covered by non-keratinized stratified squamous epithelium. Gingival epithelium, it covers the crest and outer surface of marginal gingiva and surface of attached gingiva. Circular epithelium, it lines the gingival sulcus. It is thin, non-keratinized, stratified squamous epithelium without red plaques and extends from coronal limit of junctional epithelium to crest of gingiva. Junctional epithelium, it consists of collar-like band of non-keratinized stratified squamous epithelium. It is attached to tooth surface with basement membrane. Development of junctional epithelium and gingival sulcus. After enamel formation is complete, enamel is covered with a reduced enamel epithelium attached to tooth by hemidesmosomes and basal lamina. During eruption, tip of tooth approaches oral mucosa, causing endoplasmic epithelium, reduced enamel epithelium, and oral epithelium to meet and fuse. Once tip of crown has emerged, reduced enamel epithelium is termed junctional epithelium. As a tooth erupts, reduced enamel epithelium daughter, a shallow groove develops between the gingiva and tooth surface to form the sulcus. The attachment of a junctional epithelium to tooth is reinforced by gingival fibers, which brace the gingival against the tooth surface, hence called the dentinogingival unit. Dentinogingival fibers, second is the longitudinal fibers, circular fibers, alveolo-gingival fibers, dentinoperiosteal fibers, transeptal fibers, semicircular fibers, transgingival fibers, interdental fibers, and vertical fibers. Gingival fibers bind attached gingiva to the alveolar bone and tooth. ठीक है, gingival fibers क्या होते हैं? Bind the attached gingiva to the alveolar bone and tooth. Four groups. Number one is the dentinogingival fibers. What is the dentinogingival fibers? From cervical cementum to lamina propria, most numerous. Second is the alveolo-gingival fibers from alveolar crest into lamina propria. Third is the circular fibers, circle the mouth. the tooth, and fourth is the dentinoperiosteal fibers from cementum into periosteum of the alveolar crest and surface of alveolar bone. Microscopic features of gingiva. Broadly speaking, gingiva is made up of the epithelium and connective tissue. The gingival epithelium can be studied under three headings: outer arc oral epithelium, circular epithelium, and junctional epithelium. The oral epithelium, oral circular epithelium, this is the junctional epithelium, this is connective tissue, and the bone, alveolar bone. Oral epithelium faces oral cavity, is parakeratinized, shows reed pecs and connective tissue papillae. Circular epithelium faces tooth without connecting it. Thin non-keratinized stratified squamous epithelium, no granulism and corneum layers, stands from the coronal end of the junctional epithelium to the crest of the gingival margin. Junctional epithelium provides contact between gingiva and tooth. Stratified squamous non-keratinized epithelium, 3 to 4 cells thick in early life, increasing to 10 to 20 later. Derived from the reduced enamel epithelium. Attachment to tooth, inner basal lamina. Attachment to gingival connective tissue, outer basal lamina. Blood supply of gingiva. Periosteal arterioles along facial and lingual surface of alveolar. Vessels of periodontal ligament extending into gingiva and anastomosic with capillaries in sulcus. Arterioles which emerge from crest of interdental septa, two anastomos with vessels of periodontal ligament, capillaries in gingival cervicular areas, and vessels that run over alveolar crest. Nerve supply of gingiva, terminal branches of periodontal nerve fibers, branch of infraorbital or palatine or lingual, mental, and buccal nerves. Hard palate. It is keratinized masticated mucosa. It is pink in color, which is freely attached to underlying structures. Microanatomy of hot palate, palatine gingiva, adjacent directly to teeth, which is similar to the previously described gingiva, but mucogingival junction is not present. Median palatine wave extends from the palatine papilla posteriorly. Palatine papilla incisive is pear-shaped and is a form of dense connective tissue that contains the oral part of nasopalatine duct. This duct is lined by the simple or pseudo-stratified pulmonary epithelium rich in goblet cells. Median palatine ref, it is difficult to differentiate between lamina propria and submucosa. Radiating from this ref, transverse folds called the palatine rugae which is formed of dense connective tissue covered by epithelium. The anterolateral area, fatty zone, this area present between the ref and the gingiva internally. Its lamina propria is fixed to periosteum by bands of fibrous connective tissue, dividing the submucosa into compartments containing fat cells. The periosteal, the posterior lateral area glandular zone, ठीक है. इंटीरोलेटरल एरिया क्या है, फैटी जोन. एंड पोस्टीरियर लेटरल एरिया क्या है, ग्लैंडुलर जोन, present posterior to the fatty zone. The submucosa contains pure mucous glands. The fatty and glandular zones acts as fusion. The connective tissue of hard palate is thick interiorly than posteriorly. Non-keratinized mucosa, lining mucosa, present in areas not subjected to high levels of friction but is mobile and disensible. Firmly attached to underlying mucosa, soft palate, lip, cheek, ventral surface of tongue. Loosely attached to underlying structures as bone, fascia or muscle, floor of mouth, vestibule, alveolar mucosa. Masticated mucosa, non-keratinized, flexible, withstanding stretching, interface with connective tissue smooth. Lamina propria is thick with a few collagen fibers. Irregular elastic fibers provide extensibility attached to muscle by collagen and fibers retraction of mucosa during mastication. The masticated mucosa are non-keratinized, flexible, withstand stretching, interface with the connective tissue smooth. Lamina propria is thicker with fewer collagen fibers. Elastic fibers provide extensibility attached to muscle by collagen and elastic fibers retraction of mucosa during mastication. Lip and cheek epithelium lamina propria submucosa. Lip and cheek non-keratinized stratified squamous epithelium. लिप एंड चीक में एपिथेलियम कौन सी होगी, नॉन केराटिनाइज्ड स्ट्रैटिफाइड स्क्वेमस एपिथेलियम. Vestibular fuzz and alveolar mucosa, non-keratinized stratified squamous epithelium. Inferior surface of tongue and floor of the oral cavity is non-keratinized stratified squamous epithelium and soft palate non-keratinized stratified squamous epithelium. Lamina propria, short irregular papilla and short irregular papilla in the for convex mucosa loosely attached to the underlying structures and inferior surface of the tongue and floor of the oral cavity, floor of the mouth, papilla are short. On the inferior surface of tongue short but numerous. In soft palate, the lamina propria has a distinct layer of elastic fibers separating it from submucosa. Connective tissue papilla few and short. Submucosa has strands of loose connective tissue with fat and small mixed glands. Vestibular pharynx and alveolar mucosa are some mucosa of loose connective tissue seen in alveolar mucosa, no muscle fibers present. The mucosa in floor of mouth has adipose tissue. In inferior surface of tongue are separate submucosa cannot be identified. Soft palate relatively loose and contains plenty of mucus glands. Lining mucosa underside of tongue, inside of lips, cheeks, floor of mouth, alveolar process for as gingiva, and epithelium thicker than masticated mucosa, surface flexible, can withstand stretching, interferes with connective tissue, smooth with slender connective tissue papilla, lamina propria thicker, few collagen fibers which follow irregular course between incurring points. Associated with elastic fiber control extensibility of mucosa, where lining mucosa cover muscle, it is attached by a mixture of collagen and elastic fibers. As mucosa slacks with movement, the elastic fibers track mucosa and prevents injury by biting. Submucosa thick and loosely attached in alveolar mucosa and floor of mouth, underside of tongue firmly attached. Clinical considerations lining mucosa is soft and pliable, gingiva and hard palate covered by the thin immobile layer. Local injections, fluid introduced easily into loose lining injection into masticated mucosa is difficult and painful. Biopsy wounds lining mucosa gaps and requires shutting masticated mucosa does not. Inflammation, accumulation of fluid, obvious and painful in masticated mucosa. In lining mucosa, the fluid disperses the inflammation, not that evident or painful. Next is a specialized mucosa. Dorsal surface of tongue, the connects the epithelium to the underlying skeletal muscle. The epithelium is modified, keratinized, stratified, covered with papilla, which can be seen by naked eyes. The different papilla found on the dorsal surface of the tongue are number one is the filiform papilla, fungiform papilla, circumvallate papilla, and foliate papilla. Okay. Four different types of the papillas are present. Number one is the filiform papilla, fungiform papilla, circumvallate papilla, and foliate papilla. Parts interior to third, first pharyngeal arch um, as body, trigeminal nerve, papillary portion. Posterior one third pharyngeal arch as base nerve, and the lymphatic portion, lingual tonsil, separated by V-shaped groove sulcus terminals. Filiform papilla interior tongue, cone-shaped structure, connective tissue core covered with a thick keratinized epithelium, velvety appearance of tongue, though abrasive surface so function as a masticating mucosa. Build-up of keratin leads to elongation. Internalization leads to hairy tongue. Fungiform papilla are scattered between numerous filiform papilla at the tip of the tongue. Smooth, round structures, mushroom shape. Fungiform papilla and filiform papilla. Smooth, round structures, mushroom shaped, red, highly vascular connective tissue core, and thin, non-keratinized epithelium. Taste buds present on the superior surface. Circumvallate papilla, 8 to 10 in numbers, adjacent and interior to sulcus terminalis, surrounded by deep circular groove into which ducts of one ulnar salivary glands open. Connective tissue core covered by keratinized epithelium squarely. Lateral walls and keratinized epithelium. Foliate papilla are located in the first along the posterior sides of the tongue. They may be lined with taste buds. They are not prominent in human beings. Papillas are mainly concerned with different taste sensations. Velvet papilla are better. Figuriform papilla sweet and soft. Foliate papillas are sour. Velvet papillas क्या है? Bitter और what taste होता है? Fungiform papillas sweet uh, and salty. Foliate papilla is a sour. Parts present in all tongue papilla except piriform, soft palate, posterior surface of epiglottis. They are intraepithelial structure. Barrel are ovoid with roundness resting on buccal mucosa and end with a narrow opening toward the epithelial surface and called taste pore. Flattened small epithelial cells surrounded the taste pore. Histology of the taste buds. Each taste bud is composed of about three modified epithelial cell types. Outer sporting sustainacular cells arranged like layers of onion and are in contact with the epithelial cells. Inner sporting sustainacular cells, they are shorter and rod-shaped cells. The basal cells, connective tissue, Gastry receptors cells, protein cells, and stratified squamous epithelium. This is a gastric hair, and this is a taste pore. Cells, neuroepithelial cells, they are 11 to 12 in number and present between the inner supporting cells. These cells are slender with a dark stained nucleus and apically stiff bristle like process extends to the space beneath taste pore. Nerve plexus present in connective tissue below the taste buds. Some fibers enter it and end in contact with the taste cells. As the small rounded or oval elevations due to aggregations of lymphatic nodules in underlying connective tissue known as lingual follicles. Histologically, lingual follicles covered by the stratified squamous epithelium, non-keratinized, which extended down in many sites to form lingual crypt. The lymphatic tissue surrounds the crypt and composed of venal centers and lymphatic tissue fills the spaces. Ducts from underlying salivary gland open to the forms a part of a lymphatic ring between mouth and nose from one side and pharynx on the other side. These buds of 30 to 80 spindle-shaped tissue by basement membrane apically terminates just below the epithelial surface in a taste pit that communicates with the surface through a taste pore. Three types of cells. Type 1, light, most common. Type 2, dark, contain vesicles adjacent to intraepithelial nerves. Type 3, intermediate. There are three types of the cells in taste buds. Number one is the light, most common. Type 2, dark, contain vesicles adjacent to the intraepithelial nerves. Third is the intermediate. This continuity presence depends upon presence of a functional gustatory nerve. Taste bud cells and Merkel cells are the only truly specialized cells in oral mucosa. Origin sweet, addictive, salty, and sour on lateral aspects, bitter and sour at posterior region. ये टेस्ट रिसेप्टर्स क्या है सॉल्ट sour, sweet, and bitter, protein coated, and yummy, and tea. Generation of taste to lime, absorption of molecules into membrane receptors on surface of taste bud cells. Activation of signaling cascade release of transducin and transducin, membrane polarization, release of transmitter substance, and stimulation of unmyelinated nerve fibers of rasopharyngeal nerve. Taste overall, sensory functions, saliva chewing efficiency, mix and delicate foods, flavor, smell, cranial nerve, olfactory, fruit, burn, reason, spicy, and beans, hot sauces, coffee, breads, pasta, trigeminal touch, temperature, pain, and taste cranial nerves 7, 8, 10, uh, 9, 10, sugar, salt, sour, bitter, yummy, uh, taste for taste. The durian fruit smells horrible. Some people cannot bear to eat it because it smells so foul, but it's the king of fruits and tasted delicious. It is very large and be the size of a ball and comes from Southeast Asia. Next is the junctions of oral mucosa. Three types of the junctional oral mucosa. Mucocutaneous junction, mucogingival junction, and dentinogingival junction. Three junctions of the oral mucosa. Number one is the mucocutaneous junction. Second is the mucogingival. This is the dentinogingival junctions. Cutaneous junction, the skin with the hair follicles and the sebaceous and the sweat glands is continuous with the oral mucosa at the lips. Epithelium keratinized with thin, long connective tissue papilla containing capillary loops. This brings blood close to the surface, gives strong red coloration called red vermilion zone. The line separating vermilion zone from skin of lip called the vermilion border. In young persons, this border demarcated sharply, less diffuse. Vermilion zone lacks glands. It tends to dry out, becomes cracked, and sore in cold weather. Between the vermilion zone and ice. In infants, this region is thickened and more opalescent, settling bad. Mucosa and more than one most red is between attached gingiva and alveolar mucosa. Big groove and change from bright pink of alveolar mucosa to paler. Epithelium of attached gingiva is keratinized keratinized. Lamina propria contains numerous next is a dentino-gingival junction. Region where oral mucosa meets surface of tooth. Important because it represents a potential weakness in the otherwise continuous epithelial lining. Principal seal between epithelium and enamel. In germ-free animals and strictly healthy plaque-free gingiva sulcus is absent and gingival margin corresponds to the coronal extent of junctional epithelium. In average human mouth, gingival sulcus has a depth of zero point 0.5 to 3 millimeter with an average of 1.8 millimeter. Clinical considerations, the basic considerations in oral mucosa are variation in tissue color, dryness, smoothness, or firmness and bleeding tendency of gingiva. A periodontal pocket, it is a pathologically dependent gingival sulcus as a response to plaque toxins and a subsequent immunological response. Restorative dentistry in young patients when the clinical crown is smaller than the anatomic crown. It is difficult to prepare for our an abutment or crown. The restoration may be required replacement when the crown is fully exposed. Gingival recession may result in a mental root caries and sensitivity of the exposed dentine. Keratinization of gingiva can be achieved by massage or brushing, thus helping in stimulation and minimizing plaque accumulation. Discoloration of gingiva, metal poisoning by lead or bismuth causes characteristic discoloration. Blood diastasis can be diagnosed by the characteristic infiltration of the oral mucosa. Viral diseases like measles manifest as typical lesions of oral mucosa. Changes of tongue in scarlet fever, atrophy of lingual mucosa causes specular redness of strawberry tongue. Systemic diseases such as vitamin deficiencies lead to typical changes as magenta tongue and beefy red tongue. Macule, a flat spot, stain, discoloration of oral mucosa, amalgam tattoo, and nervous rash of secondary syphilis. Papular, small rounded pimples like variably colored, white variably patterned elevations of lichen planus. Plaque, a slightly raised, clearly demarcated area that may be smooth, baby cracked or fissured, leukoplakia, erythroplakia. Vesicles, small circumscribed, elevated blister, not more than 5 mm in diameter, with a covering layer of epithelial cells and containing an accumulation of fluid, herpes labialis. Pustules are vesicles predominantly containing pus. Large vesicles are blisters, pemphigus, and drug reactions may appear white due to necrosis of epithelium forming pseudomembrane. Ulcers, sore characterized by the loss of epithelium, yielding a punched outer area. Traumatic ulcers, aphthous stomatitis, cancer, and tuberculosis. Fissure, narrow linear crack of epidermis with an ulcer at its base. Fissured tongue. Erosion, partial loss of upper layers of epithelium, toothbrush, trauma, erosive lichen planus. Cyst cavity lined by epithelium containing fluid or cells, gingival cyst. Nodule, localized elevated mass of tissue projecting from surface, fibroma, mucosine. Tumor, swelling of part of an organ, inflammatory, developmental, or neoplastic. Carcinoma is a malignant tumor of epithelial cells. Wheel, pediatric retinal odontomatous papule allergy. Sinus tract, bleeding from underlying cavity, cyst or abscess and opening onto the surface. First, white depressed mark line are an area representing healing after injury, gingivectomy, epizectomy, deep inflammation, previous trauma. this is a table, the oral mucous disorders, diseases, critical pemphigoid, mucous membrane, bullous pemphigoid, and uh, mucous membrane, pemphigoid, and this is a main epithelial hemodysmosome com- components. Recent advances in pathological conditions, the cytokeratin profile of epithelium has been seen to be altered. Uh, Pancytokeratin antibodies are now in use to differentiate neoplasms, also helpful in determining the origin of cells within jars and to differentiate odontogenic cells from non-odontogenic cells. Cytokines 30. Age changes in oral mucosa in early patients as a smoother and dry surface than younger patient due to dry therapy or any systemic diseases. Epithelium appears thin histologically, flattening of epithelial ridges, reduction in number of filiform papilla. Langerhans cells becomes fewer with age, leading to decreases in cell-mediated immunity. A decrease in cellularity occurs in lamina propria with the increase in collagen. Sebaceous fortaces, spots, glands of leaves, and cheeks increase with age. Early post-menopausal moment, we have symptoms such as dryness of mouth during sensation and abnormal taste. Thinning of the epithelium occurs in relation to prosthetic devices covering the surface of the mucosa. Changes in salivary flow due to age, radiation, or disease disrupt the normal maturation and differentiation of the oral of the epithelial cell layers. The healing capacity of the oral mucosa is greater than that of the skin. Orthodontic surgery to move segments of the mandible and maxilla can be performed using an intraoral approach to take advantage of these characteristics. Surface of the oral cavities is mucous membrane and its structure varies in apparent adaptation to function. Clinically dry, friable, thin smooth mucosal surface, loss of elasticity and stiffening predisposed to trauma and uh, according to Messrs. Tissue fibrillity arises from three sources. A shift in water balance from the intercellular to the extracellular compartment and diminished kidney functions result in dehydration of the oral mucosa. Progressive thinning of the epithelial layers which increase tissue vulnerability to mild stress and nutritionally deficient cell. Histologically, thinning of the epithelium, loss of cohesiveness of epithelial cells, vitamin A deficiency, decreased prominence of reticules, loss of submucosal elastin and fat, increased fibrous connective tissue, degenerative alteration of the collagen, vitamin C deficiency, result in a mucosa which is more prone for traumatic injuries and delayed wound healing. Migration of juxtational epithelium forms is normal position to the position more apical gingival recession. Oral mucous membrane maintains the integrity of the oral cavity in health and disease. Knowledge recording the mucosa aids in detecting any changes from normally, which would have the pay of a way of for diagnosing various disorders which affect the mucosa and thus providing treatment for same. Also, as public health dentist, educating people regarding the detection of changes in the mucosa would help in early diagnosis and hence focus on prevention in short. For today, oral mucosa is complete. Any question? ओरल म्यूकोसा में कोई प्रॉब्लम है अदरवाइज जो इसमें टेबल्स दिए गए हैं उसको अच्छे तरीके से आप याद कर लें आपको ब्लड सप्लाई नर्व सप्लाई what is the difference between the keratinized and non-keratinized epithelium uh, what is the gingival fibers uh, जो हैं वो आपको इसमें बहुत बहुत मोस्ट इम्पॉर्टेंट हैं व्हाट इज़ द लैंगरहैंस सेल्स मर्कल सेल्स और व्हाट इज़ द फंक्शंस ऑफ सेल्स क्या है ओरल म्यूकोसा मेम्ब्रेन के एनी क्वेश्चन ओरल म्यूकोसा आपको समझ आ गया है कि क्या है एनी क्वेश्चन कोई प्रॉब्लम तो नहीं है ओरल म्यूकोसा में कोई ऐसे कोई चीज़ समझ नहीं आई है या कोई प्रॉब्लम है Gastric mucosa covers areas like heart, palate and gingiva. ठीक है gastric mucosa में क्या आता है क्या heart, palate और gingiva आता है ठीक है जो gastric mucosa है वो covers क्या है heart, palate और gingiva को cover करता है which is post the compressive and shear forces and to abrasion during mastication of food ठीक है एपिथेलियम क्या है इसमें मॉडरेटली थिक होती है फ्रीक्वेंटली ऑर्थोकेटनाइज्ड दो एरियाज ऑफ पैराकेटनाइजेशन में बी सीन जंक्शन बिटवीन एपिथेलियम एंड लैमिना प्रोपिया क्या होता है कि थिन होता है कंटेन्स डेंस नेटवर्क कोलेजन फाइबर्स एज लार्ज क्लोजली पैक्ड बंडल्स ठीक है म्यूकोसा टू रेजिस्ट द हैवी लोडिंग Gingiva क्या है Mysticatory mucosa ठीक है covers the alveolar process of the jaw and the strongs of the neck of the teeth stratified squamous epithelium may be keratinized and non-keratinized but most often it is the parakeratinized ठीक है टाइप्स ऑफ जिंजावा क्या है थ्री टाइप्स ऑफ जिंजावा होते हैं फ्री आर अनअटैच जिंजावा अटैच जिंजावा एंड इंटरडेंटल पेपिला ठीक है Attached gingiva क्या होता है? It is a part of the oral mucosa that is from the necks of the teeth and forms a free margin to the gingival tissue. Attached gingiva क्या होता है? Lies between the free gingival groove and the alveolar mucosa. Junctions of the attached gingiva and the alveolar mucosa is called the microgingival junction. Interdental papilla, part which stands between the two teeth up to the contact point, is called the interdental papilla. ठीक है, due to the margins also concave, due to inflammation interdental papilla loosen and its concavity. Cole, connecting facial and lingual side of the interdental papilla on the proximal side is an epithelial structure is called the cole. This is a hard palette, okay? It is characterized by strict mucosa. It is pink in color, which is firmly attached to the underlying structures. Okay, okay, okay. Thank you very much. Okay, Allah Hafiz.